Hey, this is Paul Hassenjager. I am a physical therapist with Active Body Physical Therapy here in Southern California, and you're watching Active Body PT TV. Today I'm going to talk about sciatica, pinched nerve, low back pain going down your leg. This is a big, common, huge problem. Depending on what statistics you read, 80% of the population may have low back pain and sciatica at some point in their life. So if you haven't had it, you may. But anyway, I'm going to show you some things that can help to get rid of that, some things you can do at home to help to get rid of that. So the sciatica is an irritation of the nerve that comes out of your lower back, your lumbar spine, runs through your hip and down the back or side or even the front. It just goes into your leg. There's different branches, and it can go clear down to your foot and your toes. And that can feel like tingling, burning, numbness, weakness. Some people say it's a cold feel. Some people says it feels kind of like an electrical shock. So it can be any of those problems and sensations, and it is not fun. So what we want to have happen is we want that pain to roll up out of the leg, retract back to the hip and back, and then finally be gone. So these few exercises are going to help you to start to accomplish that at home. So the first one, and you can do this sitting, is I call it a nerve floss. So the sciatic nerve comes off your spinal cord and through a space in your low back, and sometimes that can get a little bit scarred up or pinched down. So what you're going to do is I call it heads up, toes up. So you're going to pull that toe up towards the ceiling, and you're going to look up and extend your knee like that. And we're going to hold that for about a 5 to 10 count. Then we're going to point down, toes down, and nose down. And hold that for about a 5 to 10 count. Toes up, and toes down, nose down. And you can do that about 10 times or so, as long as it's not making your pain worse. You want to start feeling it coming out of your leg. And what's that doing is it's sliding that sciatic nerve through that tunnel and trying to loosen that up and free things up a little bit. So that's your sciatic nerve flossing. The next one, if you can get in this position, and one exercise does not always fit everybody. So if any of these make you worse or you have more symptoms, you definitely want to contact your MD or your local physical therapist and get their opinion, and you'll get some professional help. But we're trying to give you some ideas to start things at home. So the next one is just going to be laying on your stomach. So if you can get on your stomach and lay just flat, not even with a pillow, but just flat in this position, and maybe do that for a couple minutes. You want to start to feel that pain lessening in your leg, maybe coming out of your calf. Now it's only up behind your knee or behind back here, coming up. It may not do it immediately, but do it a minute or so. If that's okay, and you can do that for a minute. So if it's not okay, you might want to use a pillow underneath your hips. So you're getting a little bit of a bend in your hips, and maybe start there. Sometimes you might need 2 pillows. Sometimes you kind of got to get propped up a little bit. So get your chest down and get the pillow underneath your hips. And you're looking where your comfortable start is. So this would be the easiest. This would kind of be the next step if you can do it. And then the next step would be to prop up onto your elbows or get a little bit in a back bend like this. And you may do a few of those, like up and down. You may hold for about a 10-second count and back down. And you may do a few of those. And you want to feel that nerve pain is coming up out of the leg. That sciatic pain is lessening and dimming. And you can do these every hour or so. And again, it may not be immediate, but if it's not getting worse and you get some relief, that's a good sign that these could work for you. And then the next most advanced move is going up a little bit higher. Maybe from your elbows, you're going to come up like this and do a back bend. You don't want to bring your hips up. You want to keep these hips down on the table. You want to do a back bend. In yoga, I think they call it the cobra. So that, maybe 10 of those for about a 10-second hold. And you want that pain coming out of the leg. So none of these should make you worse. If they do, go back a level or definitely contact your PT or your MD. One little adjustment you can make, if say you're just having right-sided pain, when you lay down, I want you to bend to your right. So in this case, if I'm having right-sided pain, I may move my legs to the right and move my body to the right. So I'm kind of in a banana shape. And then I can do a little bit of a press up that way to try to get that nerve pain out of the leg. And maybe 10 of those. Again, none of these should make you worse. If they are, stop or go backwards. A couple other ones you can do. Standing back bends, just this way. A lot of times that helps. Or over here with your hands against the wall and you're kind of just pushing your hips into the wall that way. Get another way to do a back bend. So those are all what we call McKenzie extension exercises to get rid of sciatic pain. Hopefully that's a good starting point and helps. If you like the video, hit the subscribe button or give us some comments below as well. We like ideas for new videos, what you'd like to see. Thanks for watching Active Body PT TV. And remember, we want to be the terminators of your pain. Thanks for watching.